We're at iMedical Equipment and Service. We're looking at the Stryker CHG Spirit Select Hospital bed. And the Spirit Select Hospital bed is an excellent bed for long-term care, home care. These beds are actually used a lot in hospitals. They are a little bit of what we might call a specialty bed, because these particular beds sit low to the ground. And I've got the bed right now in a chair position, and you can kind of get a feel that this bed does sit low to the ground. They use them sometimes for amputees. They use them for pediatrics, seniors, people transitioning in and out of a wheelchair. And the Spirit Select bed, obviously for home care, is also good. Now, I've done some home care or long-term care videos. One thing about this bed also that you'll see as far as entrapment, it has a set of rails that basically come down to about your hip or your upper thigh, but right down in this section right here, there's still plenty of room for a patient to get out of the bed if they absolutely had to, so it doesn't violate any entrapment rules. Now, one thing that's nice about the bed, you have a full set of controls here at the foot of the bed. And this is full set of controls you'll have with any commercial grade hospital bed. So it's obviously in a chair position. I've got the scale and a bed exit alarm system on here. And then I also do have all the features for lockouts and different types of features that I might need, CPR release, what have you. So as far as scale, bed exit alarm, those are standard features you're going to find in every hospital bed. If you're using it for home, you might not need to do that. But this particular bed is known to be pretty reliable. CHG was the original manufacturer, so it comes off as a few different names. CHG is the manufacturer that made the bed. They were purchased by Stryker. I think right here, if you see it, still says CHG on it. But Stryker bought this bed and bought the CHG company, so technically for maybe the last 3 or 4 years, it is a Stryker hospital bed. Now the CHG bed also can be configured as a psych bed. This one obviously is not, but they can close off the handrails and they can also shorten the cord, and they have different configurations that they can put on that. The bed obviously down is low. I'm going to go ahead and just lift it up here. And once I lift the bed up, you'll see that the bed actually goes up plenty high. So if you're dealing with caregivers or nurses, they don't have to bend over to take care of the patient. And that's kind of nice. It has a solid bed pan on it, so, or bed deck as we might call it here. It's plastic instead of metal, so it's not quite as heavy. And the one thing nice about this bed is it's, you know, with all the different plastic on some of the bed pans, the bed's not going to rust. And I'm 6 feet tall, and this bed is coming up now past my midsection into my, you know, just below my rib cage basically. So there's never ever going to be a problem with somebody having to bend over to take care of a patient. You can see now it went from low to the ground and now plenty high to the ground. Now we sell the Stryker CHG beds. These are popular beds for home use, but as I said, we get these out of hospitals, so hospitals are using these a lot as well. With that low height, you can transition off a wheelchair into bed very easily. And then, like I said, you've got the full set of controls here at the foot of the bed for a nurse or a caregiver. You also have a set of controls on the inside of each rail for the patient. And you have controls on the outside of the rail here also for the assistant or caregiver that's going to be there. One thing that's nice, you've got the degree right there. This head section will go up to 70 degrees. That's common for most hospital beds. Very easy release button right there to push in to drop the rail. And then you also have these little sections right here along the side of the bed, and that's basically to secure an air mattress onto the bed. So if you ever wanted to configure this with an air system, you could do that, and you strap the air mattress into these little sections right here, and it keeps the air mattress from sliding down. And then, like I said, this is plastic instead of metal, so it's not going to rust. Obviously, it makes the bed look good. And one thing also is that this particular bed is not white. It's sort of a tan color, so it's not quite as sterile as a white hospital bed might be. But that's another standard feature. So If you're interested in high-low beds, this bed sits 10.75 inches off the ground, just under 11. Mattresses are normally 6, so ballpark, you're into it for about 17 inches, which is about 4 to 7 inches lower. 4 to 8 inches, depending on the bed, lower than the average bed. And that makes a big difference when you can get out of a wheelchair and drop down into the bed and not have to lift your body weight upwards. So once again, we're looking at the Stryker Spirit Select, aka also known in some circles as the CHG bed, Spirit Select. But once again, we sell these used, refurbished all over the United States, all over the world. iMedical Equipment and Service. Give us a call. We are located in San Diego, California, 858-263-4894. Richmond, Virginia, 804-929-6886. More information off our websites at www.onehospitalbeds.com and also www.imedicalshop.com. iMedical Equipment and Service, looking at the Stryker Spirit Select iMedical Equipment and Service. We're your one-stop shop for all your hospital bed needs.